One of my favorite topics to talk about with the new families is immediate skin-to-skin contact after birth. And the reason I love talking about it is because it's a simple thing you can do that can make a huge impact. So what this looks like is immediately after baby's born, as long as you're healthy and baby's healthy, baby should be placed immediately on your chest. This is so important for both you and baby. First off, this helps stabilizes baby's body temperature. Babies have a hard time regulating their temperature, and when they're placed on your chest, you act as a little warmer for your baby. Also, this can significantly improve breastfeeding outcomes. So we have to remember that baby was just getting everything they needed from the placenta. They are not born starving. They are born with the urge and the instinct to latch, but not starving. So this first moment of breastfeeding is not so much about calories and feeding your baby as it is about your baby really having this developmental step and milestone to learn how to latch. So with skin-to-skin contact, what we want to do is we really want to place baby in between both breasts on the chest, and we want to not rush this moment. We want to allow our baby to explore. Many babies, we call it the breast crawl, will actually start inching their way over to the breast themselves and will start exploring. We only need 1 10-minute feeding within the first 2 hours after birth. I see this moment as a really important developmental milestone for your baby. The way I look at it is we can think about it like when a 1-year-old is learning to walk, right? You don't teach a 1-year-old to walk by saying stand and lifting their legs and showing them like one foot in front of the other, here's your balance. No. The way a 1-year-old learns to walk is you create the right environment for them so that they themselves can explore and the synapses in their brain can connect, and then they make that leap in order to successfully start walking. And that's how I want you to view this skin-to-skin contact in this first moment of breastfeeding. That your baby themselves is born with the intelligence and with the instinct and with the urge to latch. And we want to give them the right environment, leave them on your chest to explore. Of course, if baby's getting frustrated or needs more help, we can bring baby more actively over to the breast and help them latch. But I really want to emphasize to you, it is not a rush, okay? Allow your baby to explore. Also, having baby on your chest after birth releases more oxytocin in your bloodstream, mama. And this can actually help your uterus to contract postpartum, which is so important because that manages your postpartum bleeding and brings down that risk for hemorrhaging. And also the bonding that happens in this moment, the connection that can happen. So it's really important. Please advocate for immediate skin-to-skin contact after birth. Some hospitals are what we call baby-friendly hospitals. And that's a designation from the World Health Organization. And those hospitals have to, it's policy, do immediate skin-to-skin contact for 1 to 2 hours after birth. If you're giving birth at one of those hospitals, great. At other hospitals, it's a nice to have, but not a have to have. And in those situations, you really oftentimes have to advocate to keep baby on your chest. And I really want you and your partner to do that. Make sure you get that time for both you and baby. As long as baby's healthy and mom's healthy, they can do all immediate assessments that they need to do on your chest. And after that 1 to 2 hour window, then they can bring baby over to the warmer and you can find out what your baby weighs and they can do more assessments in that way. And one quick note on all this, I love when partners do skin to skin as well. And I think a great time for partners to do skin to skin is after, mom has her 1 to 2 hours and then they've weighed baby, done all the assessments, given baby any of their newborn meds. After that, then hand baby over to partner. Partner can do really nice skin to skin contact. And then mom who gave birth can, eat her sandwich or take her nap or do whatever she needs to do, catch her breath after giving birth.